Sign number 5. Overwhelming fatigue that rest can't fix. The 5th sign that catches people off guard is a bone-deep exhaustion that feels completely different from normal tiredness. This isn't feeling worn out after a busy day. This is waking up exhausted after 8 hours of sleep and struggling to complete simple tasks. Inside your body, cancer cells are essentially hijacking your energy supply, competing with healthy cells for nutrients and leaving you drained. Patricia, a 62-year-old teacher, described it perfectly. I felt like someone had pulled the plug on my energy. Even walking to my mailbox felt like climbing a mountain. What makes this fatigue particularly dangerous is how it's accompanied by emotional changes. Unexplained sadness, anxiety, or irritability that seems to come from nowhere. The exhaustion doesn't improve with rest, coffee, or even vacation time. Instead, it slowly worsens over weeks or months.
When tumors interfere with this process, the results are unmistakable. Unlike typical indigestion, these problems persist for weeks. You might experience chronic nausea, vomiting after small meals, or persistent bloating that doesn't respond to toxins. Construction report noticed his appetite disappeared almost overnight. I have to leave my nose cooking, Robert showed. Suddenly, even the smell of food made me nauseous. I lost 20 pounds in 6 weeks without trying. The most telling sign was changes in his stool appearance. They became pale, greasy, and had an unusually strong odor. This happens because the body can no longer properly break down and absorb fats, leading to malabsorption and nutritional deficiencies. The combination of poor appetite, nausea, and malabsorption creates a cascade of problems that weakens the body's ability to fight disease. What to watch for? Persistent nausea lasting more than 2 weeks, loss of appetite without clear cause, unexplained weight loss, and changes in stool appearance or odor. These aren't just digestive annoyances, they're your body signaling that something deeper needs attention. It often worsens after eating or when lying flat. forcing people to sleep in recliners or propped up with multiple pillows. The pain may come and go initially, but gradually becomes more constant and intense. Dorothy noticed the pain was worse after meals, especially tonight. Once technically infinite hours left because eating at the end unbearable, she exclaimed. The pain also intensified when she tried to sleep flat, eventually requiring her to stop sitting up all the time. Key characteristics. Deep, gnawing, abdominal pain that radiates to the back. Worsens after meals or when lying down, and doesn't respond well to typical stomach remedies. This pain pattern is significant. This happens because pancreatic tumors release inflammatory substances that typically block cellular blood cells from clotting bonds. Clots, if they're unrelated pathogen, develop sudden swelling of his left leg during what cellular abnormal without blood vessel, he said. When the swelling got worse and my leg became long and reddish. What James didn't realize was that he was developing deep vein thrombosis, DV2. The intensity of quickly part of the clot breaks loose and travels through the veins, causing a pulmonary embolism, a life-threatening emergency. James experienced this firsthand as he lay couldn't catch his breath, and felt sharp chest pain that worsened with each breath. The emergency room doctor said minutes later, James replied, "If my life hadn't insisted on going to the hospital immediately, I might not have survived." The subsequent investigation revealed pancreatic cancer that had been silently growing and triggering his body's clotting system. Emergency signs to never ignore. Unexplained legs swelling with warmth and discoloration. Sudden shortness of breath. Sharp chest pain that worsens with breathing, or rapid heartbeat. These symptoms require immediate emergency care. Don't wait to see if they improve. Sign number 1. Dark brown or cola-colored urine. The first and most specific one is found description of the As a nurse, I knew this wasn't normal, but I kept hoping it would resolve on its own. When pancreatic cancer blocks the bile duct, bilirubin, a yellowish compound from red blood cell breakdown, accumulates in your body. Your system desperately tries to recognize this bilirubin from the characteristic breakdown resembles coma, strong terror. This symptom often emerges before individuals with jaundice, including scattering of eyes. Records now report tragically 55 days before she found herself in the country. After she apparently got her pancreatic, she fled. While the country rejected everything. These 5 signs aren't random symptoms scattered throughout medical literature. They're your body's sophisticated emergency communication system desperately trying to alert you that something serious needs immediate attention. Each symptom on this list represents years of medical research and countless patient experiences that have revealed patterns too important to ignore. Margaret's father story, for example, perfectly illustrates the devastating cost of dismissal. When he noticed his father drinking a step of cola-color, his first instinct was rational. Dehydration seemed like the obvious explanation. But that night, persistent for weeks, he convinced himself that experienced a persistent upper abdominal pain that radiated to her back. She initially attributed it to lifting heavy boxes while helping her daughter move. When Robert noticed his crushing fatigue and loss of appetite, maintain responding to persistent symptoms, and highly encourage loved ones to take unusual health changes seriously. The ripple effect of an awareness extends far beyond your own health.